This is LiveWell Talk on a day in the life. Today is a certified surgical technician. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Joining me today is Sara Huilman. On this episode, we're going to talk about what is a surgical technician and what they do. Welcome.
Thank you, Dr. Arnold. It's a pleasure to be here. I'll just start by saying we'll just upgrade from technician to technologist. That's what our professional organization goes by and what our titles here at UnityPoint entail.
Well, this is the first episode of sitting down with someone. We wanted to just cover, there's more than just doctors and nurses work at hospitals, right?
Absolutely.
And so we wanted to do that, and you're our VIP first inaugural visitor, and we're glad to have you as a guest on the show. But just tell us, just walk us through a day. Okay. What do you do?
Well, I know as we began prepping for this, we were asked about what a certified surgical technologist is, and in part, it's described as an allied health professional who works with the team of the medical practitioners to provide safe and effective care during surgical procedures. So our background is in theory and application of asepsis and sterile technique, human anatomy, surgical procedures, and the tools and technologies to implement those procedures. Most CSTs work in hospitals, surgery centers, or physicians' offices, perhaps.
If they do surgeries or procedures like that.
Exactly. Maybe dental offices as well. There are, according to the Bureau of Labor Statistics, there are over 100,000 CSTs practicing in the United States. And with that projection to continue to grow, like all healthcare entities are, 9% in the next decade. There's going to be a demand for up to 9,000 new surgical techs per year. So we have a task ahead of us to supply that allied health professional.
I think that's one of the things we wanted to stress with this series in the podcast is the opportunity for young people to surgical technologist, MRI technologist, ultrasound. There's so many opportunities in healthcare besides doctor and nursing, and we want to provide that opportunity to people. But we also wanted individuals to be able to listen, to hear about what you do during the day. I'm sure there's people that will watch this podcast or listen to it, and they know you, and they might not work with you. But so just take me through your average day.
Sure. So the main role of the surgical tech is to scrub in the surgical field with the surgeon and whatever assistance that he or she may need during that procedure. So we come to the OR, dress in scrubs, put on our protective gear as we do for all surgical procedures. We get an assignment for the day. We meet, as all units do, typically with a huddle. And we get an assignment, usually that comes to us the day before, and we would be given a typical room assignment, as it were, and you'll do the procedures assigned to that room with the group of people that you're assigned with. And in our ORs, we generally have 3 people. There's always a registered nurse. There may be 2, and a surgical tech or 2, depending on the needs for the procedure, sometimes more. And so we gather supplies, equipment, tools to facilitate that specialty, review the surgeon's preference card or order set, as it were, to make sure that we have everything we need. The team opens the sterile supplies. The surgical tech then would go perform their surgical scrub, where, you see on TV where people are scrubbing their hands and arms, and you're familiar with in your background and training. So then you don the surgical gown and gloves and set up the sterile field. That entails arranging supplies, equipment, etc., into an orderly fashion on what we call the back table, which is the table with the sterile instruments, etc., and then a Mayo stand, which is sort of a bridge between the patient and the table where the supplies are. Our goal is to have everything there that the surgeon would need for that procedure, and to have it ready as or before they need it. And that's one of the key goals for a surgical tech is to anticipate the surgeon's needs. And we always kind of have a game or challenge where we're trying to stay a step ahead of the surgeon. We never want them to have to wait.
I know that's a big point of pride for your department and your colleagues, that they really pride themselves on that.
Absolutely. Absolutely. It's just a good way to enlist in good care and make your surgeon, your provider, more efficient. Yeah.
What? How did you get interested in that? Were you watching TV and you saw the doctor go scalpel, and they got handed that, and you said, "That's what I want to do"? How did you end up doing that?
It was sort of serendipitous. My mom was encouraging me to go to college after high school, and I wasn't sure what I wanted to do. I have an older sister who is a nurse, now retired, and of course I admired her work, but I had a little bit of that little sister independence where I didn't want to do exactly what Mary did. So we came across this program called Surgical Technology, and I thought it just sounded interesting. So it was sort of really, I owe it to my mom. I tell people this frequently, that's where I ended up because of her, and I'm so grateful for that direction because it put me where I feel like I was meant to be. I went to community college and got my diploma, and then have done several things since then to advance my education and career opportunities. But a typical surgical tech at this time would attend a college like Kirkwood and get an Associate Applied Science degree. So 2-year degree, and part of the first year is the fundamental sciences or general ed, and then the surgical technology program would be a 3-semester surgical technology intensive, as it were, including clinical rotations where you have rotations at hospitals and surgery centers with preceptors that help provide the necessary skills. They have at Kirkwood, for instance, they have a lab. So they have a mock-up of a operating room.
Yeah, they have a really neat simulator lab, sim lab.
Yeah, and to get some of that fundamental skill set down before you enter the theater of a patient care area. And we do have an affiliation with Kirkwood where we do provide clinical experiences for Surg Tech students.
Now, I know it's a skilled position, and orientation takes, how long's orientation?
The intensive would be a minimum of 6 months.
Yeah.
A new staff member, I think that was one of your questions as we reviewed earlier, that, how do you choose what you're going to do, or how do you get beyond the fundamental procedural stuff? Does everybody do everything? And not generally. Depends on the organization and what they choose. But what we do at UnityPoint St. Luke's is we have a fundamental skill set that everybody should have. Everybody should know how to do these level 1 procedures, as we would call them. So you generally come to a new position with some of that skill set from school, because those are the procedures you participate in as a student. But once you're through that and you're assigned to a specialty team, or you volunteer for a specialty team, then you'll be with a preceptor that will work you through all the more advanced procedures, which we would call the level 3, and kind of teach you all the ins and outs, all the instrumentation, all of the special equipment, etc. So you partner up with generally one person initially, and then from there, depending on the group. So generally 6 months to get to that point to be independent enough to take call and move on to those specialty cases.
Yeah, I know you guys are well trained, and you cross-cover different specialties.
Mm-hmm.
I know that. Just I picked that up from being in meetings with you. And,
sure.
Also, but you do stuff beyond the OR. I mean, I know I worked with you and to robotic credentialing for when robots started here at St. Luke's, which you've been part of that since the beginning.
Mm-hmm.
I think you're minimalizing your influence that you had, that doctors are up to speed on that, because some of our physicians didn't receive that in their training. They had to go back and learn
Correct.
that. And it's hard to learn new things as you get older.
Sure.
So how long have you been at St. Luke's?
42 years.
Wow.
I know. It's I thought I was only going to be here for 5 when I started, but here we are. It's been my home, and I'm very thankful for that.
Well, St. Luke's probably has some labor laws to deal with, because it sounds like you probably started when you were 3 years old. Is that right?
Very close. Very
Okay.
close.
All right.
Right.
Well,
we're still brushing that under the
hopefully
rug.
the statute of limitation is out on that labor violation there. What's the longest case you've ever been in?
Probably maybe an 8-hour case. But generally speaking, we have the ability to break each other out. We have procedures in place where we can spring each other for a lunch or bathroom break as necessary. But sometimes there's a certain pride in being involved in staying with the procedure, staying with the surgeon during a very difficult procedure.
Yeah.
'Cause something that took that long probably meant it was difficult. But sometimes that just runs together. You don't, you get into those intense situations and time just sort of melts away. You focus.
Yeah.
You focus.
Yeah. Which that's so understandable. I mean, it's really, it's particularly when you have a great staff working for you, it's just probably, you don't even feel the time pass
Right.
in those long cases. So what we talked earlier about different teams and specialties. What's your favorite?
It's really difficult to pare that down. As you indicated earlier, I've had the opportunity to work in so many specialties, and I feel like I embrace everything kind of with a vigor. I would say that I am not an expert in orthopedics or neuro by any means. Those are my level 1 procedures, and but I have had the opportunity to work in general surgery. Has been kind of my primary home over the decades, and I love general surgery. I've had great mentors and teachers and partners in that realm. I've done vascular surgery. I've done, in the last year, began helping with cardiac surgery in the first scrub role to facilitate those procedures, which has been a great opportunity to sharpen my skills and to attain the expertise of Dr. Whitey as his efficiency and skill. I've worked with robotics, as you indicated, working with that team to keep our group well trained, and I work as kind of a liaison between the Intuitive. Intuitive is the robotics
company.
Yep.
Manufacturer.
So I work with those sales reps and the field service engineer to maintain the safe and effective use of the robots and preventative maintenance, et cetera. And then education of our staff and physicians as we've onboarded new people. So there's always new technology around the corner that we're adopting, and we have to stay on top of making sure that that's all working properly and people are trained to use it.
I will assure the listeners that are sci-fi fans that from a Ray Bradbury definition standpoint, it's not really a robot, right? I mean, these aren't autonomous self-thinking
These are not
machines,
autonomous.
right? Okay.
Correct.
All right. Just want to clarify that.
Right.
Well, thank you for joining me. This is I've so look forward to doing this, because one of the things that I never stopped and considered, but that I've learned in my position, is how many people touch a patient when they have surgery.
Mm-hmm.
I mean, from the schedulers to the STAR to your team, pre-op, post-op, PACU. It is, I don't think patients have any idea how many people are involved in that ballet, if you will, of all these different specialties coming together to make that happen. I used to think you just called this number and says, yeah, I'm a surgeon, I want to do a case tomorrow. like 2 or 3 people showed up and you
Sure.
did the case, and it's just so it's not complicated, but it is complex, and there is a difference there.
That's a good point.
Thank you for joining me. This was exciting, and I look forward to having others on to describe what they do each day in the hospital, because I think people will enjoy this. So, Sarah, thanks for being the first and setting the standard very high of the expectation for other guests.
All right. Well, thank you for this opportunity, Dr. Arnold. Appreciate it.
My pleasure. If you're interested in a career as a certified surgical technologist at St. Luke's, visit unitypoint.org/careers. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.